Everybody, hello and welcome to the Smart Dental Practice Show. I'm Dr. Jasmine, a dentist, a hypnodentist, and also founder of Smart Dental, both specialized in helping dentists and their team deal with the side hustle of dentistry. Welcome to the 7th episode of the Smart Dental Practice Show. I'm extremely delighted to have the brilliant Dr. Brice Lemaire with us. Hello, Dr. Brice Lemaire. Thank you so much for accepting our invitation, and please give our audience a little background. Thank you so much.
Thank you, Jasmine. It's an honor and pleasure to be with you and to discuss about these hypnodontic topics that we share together.
I love that. I love it. So, Dr. Brice, talk about like your experience. How did you start this? How did you got into dentistry? How you developed your passion towards dentistry and hypnodontics as well?
So I was graduated in 1996 at the University of Nice, and I started practicing in liberal practice, and I started getting involved in hypnosis at the beginning of the 2000s. It was because of my patient, because I had to treat some patients that were very phobic, and so I had no tool to treat them at this time. And I get interested in hypnosis. First, I would say Ericksonian hypnosis. It's more dedicated to language, techniques, stuff like this. And then I was lucky enough to meet very great hypnotists in the US, in the UK, and to make my training with them and to introduce more formal hypnosis in order to practice hypnosis in my everyday professional life.
I love that. To start, Dr. Brice, studies have demonstrated, like you said, that dental fear is very real. It's very real, and it's a phenomenon that experienced by greater than 75% of the population. 5 to 10% of them experience what we call dental phobia, and that caused them to suffer and avoid to go to the dentist for any reason. How can hypnodontics help these patients?
In fact, as a dentist, I usually say that if we want that the vision of the patient on how profession change, first we have to change our vision on our patient. And when I talk to dentists, I'm always stunned to see that they say, I don't understand why people are so scared, because we made a lot of progress in pain management with the local anesthesia. We made a lot of scientific progress with CAD/CAM and stuff like this, but they don't realize that all this scientific progress needs also psychological progress, because health is very emotional part of our body. So it's completely normal for a patient to be scared, to be afraid, or not to like going to the dentist. And I'm not talking about phobic patients, but all the studies show that I think 80%, everyone doesn't like to go to the dentist, and I would say that 70 to 80% are scared, and 10% are really phobic. When I'm talking about phobic, I'm talking about patients that collapse in the waiting room, or that are so scared, so phobic that you can't put them on a dental chair because they shut their mouth or they cry. And so it's very complicated, and they are adults, you know. And so my idea is that hypnosis is I think, the most powerful tool in the mind that we can have to learn them new behavior and to learn them new positive learning to be treated in all the medical field, not specifically dental hypnosis, but with a good comfort, well-being, and a sense of trust. And that's very important.
Oh, that's great. Maybe our audience now are thinking, what's hypnosis and how does it work?
Oh, it's very complicated to define. What I mean is that you have a lot of definition, because the word by itself is polysemantic. Hypnosis designed at the same time the result that we get, I mean the trends, but at the same time, it design also the process that we are using. So when you're referring to, I would say, medical classical definition of hypnosis, you have a lot of definition, and they are usually in contradictory together. My idea when I talking and teaching hypnosis to my student and to my patient, I just say it's very simple. In fact, during day you're conscious, during night you sleep and you dream. Hypnosis makes you a switch, cerebral switch. It makes you dream during the day. It activates the imagination, that's the trance. And as your brain is working differently, all the physiological and psychological process will be different. And it's so powerful that we can make, for example, surgery without anesthesia. We can make a lot of things, especially in the field of hypnodontics, because it's, I think, one of the field that has the most wide range of application of hypnosis. You have pain management, you have operative hypnosis, I mean treating patient, you have communication, you have conversational hypnosis, you have also a lot of tools that you can use for pain management, emotional, a lot of things about some behavior like smoking cessation, in fact, in the mouth, you have all the indication of hypnosis.
Oh, that's great. Like I used to say to my patients, like whenever, come on, let's play an imagination game, and it will help you. So I explain it like just like that, like simply. I would, and for dentists, like if you have this powerful tool, and you have many tools, like you just said, pain management, smoke cessation, dental phobia treatment. If you are to have this, let's say, a musical box full of tools, why don't you want to use it? And really, it will change your career, like forever. Forever. So, Dr. Brice, how did hypnodontics impact your career, and how did it help you?
Oh, I would say that it's a new paradigm. What I mean is that when you finish your study, you're more involved in technical things, how to treat a teeth, how to treat tooth, and you don't see the patient. And you know how work is to heal a part of the body with our hand and also with our brain, with our mind. And I think considering the patient in his globality, I mean the mind and the body, is very important, because you take really care of us, and you make the treatment is the best condition of well-being, relaxation. So that's a part, but always there's so much to say about, I would say, the rapport in human being, communication. And that's very important, because hypnosis allows you to have not a conscious communication, but subconscious communication. So it creates a difference. And at the beginning, you have, I would say, just a communication, but then with this technique of hypnosis, it creates really therapeutic alliance, and that's very important for the treatment. And therapeutic alliance is the trust between the two people, the practitioner, patient, and also in the treatment. So that's very efficient and very, I would say, very fast to get it with hypnosis.
So, Doctor, it's got like when you were talking about how it might help your career. Okay, what I was going to say is that my mentor, Dr. Valia, always told me, like, let's begin and treat patient like a patient isn't just here with his mouth. It's not just the tooth who is coming to you. It's all the patient and all his history coming with him. So let's start from there and see it in a new way. And really, hypnodontics shifted my mind about this, and how to treat the person, not just like a teeth coming to you will see just the teeth. You are meeting a person with all his emotions, his thoughts, his beliefs. And if we want to change this misconceptions about dentistry, or this whatever about dentistry, and start to try or start delivering a VIP patient experience, I believe that we have to start treating our patients as humans and as it's a whole person, not just a teeth.
Of course.
Yeah. so, Dr. Brice, that will lead us to our next question, which is why dentists should learn about hypnosis and how can they incorporate it into their dental practice?
I would see two elements. The first one is the patient experience. When the patient goes to the dentist, usually, as we said before, is afraid. And when you can bring them to a relaxed state where everything is very quiet and simple, we can make intensive, sometimes long treatments during sometimes maybe 2-3 hours of surgery, so very intense things. And we can create amnesia, we can create a lot of things to make this experience in the better way. So that's the first things. And the patients are very pleased to be treated in hypnosis because you have patients forever at this time. You have created a relationship which is very interesting with them. So they just want to be treated that way after that. So it's a good way to have patients who trust you and who refers you other patients for this kind of treatment first. Then it's very important for the kids because they must have a good experience of dental. And we see so much phobic patients that were bedridden when they were young, they had pain, they had fear, and it was managed not in the proper way. So it's very interesting to create them, I would say, primitive experience of medical things that are positive. And they show that they can have control over their mind, over their body. That's important. And I would say another side, which is very important, I must have, I don't know, maybe 10 patients a day, and I treat most of them, I would say 5 to 7, with hypnosis, you know. And as a practitioner, when you work with patients and with hypnosis all the day, it's very interesting because the energy that you need to make your job is completely different. And it's a very important part of the prevention of the burnout, of the stress for the practitioner also. So it's a win-win system, you know. The patient is relaxed, you are relaxed by treating them, and after your day of practice, it changes completely the world that you're doing.
That's great. That's really great. Like, for me, it was a changing point in my career, using hypnosis and seeing patients who were afraid of going to the dentist just like for 20 years. And once they are here, I do some hypnosis sessions and the patient is happy and he is referring all his family and come, this dentist is different. She uses something, she's different. Like, and I believe that's a plus, that if we succeed to incorporate it in our practices, it will make you like the number one dentist to go to in the city. So for me, it's really a win-win situation. As you said, your patients are relaxed, you are relaxed, and all your career changes. So that's lovely. That's so lovely. So, Dr. Brice, maybe many of our colleagues or whatever have seen some stage hypnosis, streets hypnosis, and they have some misconceptions. Like whenever I told them about hypnosis, like they go, "Oh my God, you will just make me sleep, and I will do whatever crazy things." So. What is I believe that's the most common misconception about hypnosis. How can we address it like today? If we have, if you can explain, give us more explanation about this.
Yes, in fact, when we see hypnosis from the outside, in stage hypnosis, on the TV show, on stage show, you have the feeling and the impression that the patient, the subject, at that time it's not the patient, is controlled by the operator. And that's absolutely not the case. So when I'm talking about hypnosis and when you have referral with hypnosis at your office, you must always give information to your patient. It's what we call a pre-talk, mindset, to explain them that first, hypnosis is not sleep. You will be in intense activation of the brain, like when you're dreaming. It's like a regular daydream, you know, when you're driving your car, watching TV, but you will amplify that imagination. I don't talk about subconscious and stuff like this. That's our two therapists
Yeah.
in my office. I just talk about reverie, imagination. And I say that we create an amplification of that state in order to treat them in the better situation. Then you must explain them that they can't be controlled and they have a full control, a better control of their mind, of their body. They will remember anything, everything. They can stop when they want. They can take only the suggestion that they want to have. And so during this pre-talk, you see that you must cover all the misconception and all the inhibition to go in trance, because if you want to go in deep trance, and that's the kind of trance I'm looking for and I'm using on my patient, you must have no inhibition and have a full trust in that trance. So it's very important part to explain what are the most, and there's not a lot, there's 6 or 7 misconceptions about hypnosis. So and then once they understand, you must create expectancy in order for them to start the imagination process, you know. So that's why you're usually making tests of suggestibility, things like this, just to show that that's very natural way, and they just must let it go. They don't have to analyze, or you must install the correct mindset. According to me, the trance is natural state of the mind, but you must create the frame, okay, and you must have the good posture, the good attitude. And our frame is very easy in dental practice because no one wants to be here. So when you have a tool, we say, okay, we can offer you a 1 hour of relaxation when we make the treatment. Everyone is okay to go in trance, and your posture is just to guide the patient in his trance.
Dr. Brice,
yes, exactly.
You talked about the misconceptions, and I believe our colleagues, like, it's a misconception for the dentist and misconceptions for the public, like our patients or whatever. For our colleagues, maybe explaining this, and it's a normal state, and I do explain to my colleagues, like, it's just like if you are driving your car, you are in a hypnotic state. So it facilitates for them to understand, but they ask me another question, which is it ethical to use hypnosis in the dental practice? And are there some regulations that we should learn about before we consider to do hypnosis in our practices?
First, I would like to say that the practice of medical hypnosis was, I would say, registered at the BMA, the British Medical Association, in 1955. And the recognition as hypnosis as a medical and scientific approach was made by the AMA, American Medical Association, in 1958. So it's more than 70 years. So it's been long that it's recognized, and there's a lot of studies about medical hypnosis, about pain management, about phobia treatment, about neurosis. So it's a very scientific. And since the 90s, we had all the neuroscience with the medical imagery of the brain that confirm the intuition, the empirical intuition that we had about hypnosis, about trance management. And so it's a very scientific tool. I usually say that modern hypnosis is very medical and scientific. So you study it like a science, but you must always practice like an art, because there's a human relationship. So you mustn't be a scientific when you practice. But it's very ethical. In some countries, for example, I would say in Italia, in different countries, they usually have some more problems with ethics, because there are laws that forbid hypnosis sometimes, but it's usually by misconception of hypnosis. And from my practice, in all the modern countries like the UK, the US, in Europe, I would say that hypnosis is getting is really in progress, and you have a lot of research and application of general hypnosis in the medical field, not specifically dental hypnosis. So hypnosis is a tool, you know. You can buy a hammer in every shop you want, and you can use it to fix things or to destroy things. So with hypnosis is the same thing. It's a very powerful mind tool, so you must be very very ethical in your practice. And it's just and must be just for the treatment and the well-being of the patient. I mean, in medical hypnosis, in operative hypnosis, and also in therapeutic hypnosis. Yeah.
Sorry, please.
Yeah, that ethics must be linked also to a standard of certification in hypnosis. Yeah. You can learn hypnosis in 1 weekend, but it's not it's not enough. The standard certification is usually 300 hours, so it's a lot, but it gives you the good basis to start and practicing hypnosis.
Get consent from your patient to practice hypnosis?
I don't.
Hello, Dr. Brice.
Ask them.
Your internet is open.
Yeah, I don't ask them to sign something, but I tell them that I practice hypnosis. Usually they come to my office because they know that I practice hypnosis. And also all the hypnosis stations are recorded. So
nice.
It's a very good database for research and for my training in hypnosis at the university, but also it's something in a medical legal field which is very important because they can be trustable. That's important.
Yeah, definitely. I believe that Mrs. Brice Lemaire is doing hypnodontics in like the Middle East region. Do you have some thoughts about the regulations there? Like if someone in the Middle East want to practice hypnodontics, how can he like incorporate it to his practice? Like, do you know about the regulations there? Are there some regulations there in the like because Mrs. Brice Lemaire is doing that in the US?
Of course.
Yeah.
Yes. I'm practicing Elmanhypnosis hypnosis. Well, so one of the tools that we use in hypnotherapy is the regression to the cause, and that's very powerful, especially in the case of phobic patients. I have a lot of indication of therapeutic hypnosis. I would say smoking cessation, phobia, pain management, but also a lot of behavior like eating disorder, a lot of things like this. And one of the tools that we can use in therapeutic hypnosis is the regression. That's very important and that's very interesting. So I use it a lot because according to me, it's one of the most powerful. And sometimes when I have a phobic patient, I can just make one session of hypnotherapy, and then the next session will be on the dental chair with operative hypnosis. And I would say 80 to 90%, it's largely enough to treat the issue of the phobic patient.
Dr. Brice, can you share with us a story of two of your patients, and how did hypnosis help them and get so they can get their treatment done? Like,
yes, for example,
hello, Dr. Brice, are you hearing me?
Yes, I can hear you. I like phobic patients usually because they are very good subjects for the trance, and they have such a negative imagination that you can switch it to positive. And that's usually somnambulic subject, and you can have very interesting trance for management. And one day I had a patient, he was phobic, and usually in that kind of case, we merge the first session in hypnotherapy and then all the session with dental hypnosis. And when you have something more complicated like surgery, I make it after, I would say, 3, 4, or 5 appointments. So they have the practice of trance and they can go faster and deeper in trance. So that's very powerful and interesting. And after 5 sessions, we had to make implant therapy. and the patient say, oh, okay, I'm cured, I don't need hypnosis anymore. And I put him on the dental chair, and by himself, in self-hypnosis, in fact, he fall in hypnosis immediately. So it creates an anchor, and that's, yes, and that's very powerful. And another story would be about a young girl. She was 9 years old, 8, 9, and she had definitive extra numeral teeth to extract. And she was so confident that we could make it in hypno anesthesia without any anesthetic. And I was very stunned, you know, because with kids, usually their trends are very, I would say, there's a lot of disorder. They are moving all the time. They open their eyes. They are talking. They are in trance, you know. And it was the first time that I made surgery with no anesthesia, no chemical anesthesia on such a young girl, and that she had a beautiful trance. Of course, everything is recorded, and I have a database of thousands of videos about hypnosis. And that's very useful for teaching, but also to make thesis for research at the university hypnosis.
Nice, that's great, Dr. Brice. That's really like a young girl, and she decided just to do hypnosis, no anesthesia. That's really that's really wonderful. Yeah, that's really wonderful. Dr. Brice, we came to our last question. Like, since we are health care provider, and we should take care of ourselves before we can take care of good care of our patients, how can self-hypnosis benefit us?
As I said previously, in my teaching at the university, I have a formal dental operative teaching, and we spent 2 days only about self-hypnosis technique for the practitioner, because it's such a powerful tool that it would be a pity not to use it for ourselves first. And then self-hypnosis is about practice and practice. So you must discover a lot of tools, and it's very important because you can manage stress for yourself. You can manage communication at your dental office in different way. And also it's a very good prevention for the burnout. You know, burnout is a pathology that is very increasing in the medical field since last year, because we all have, I would say, conditions based on time. And each time that you're based your work on a timeline, it activates the stress system. So you must be very careful, and it's a very powerful tool, and it helps in the day life practice a lot.
That's great. Like, I do use self-hypnosis, and I believe like that's really a powerful tool. Sometimes it's just to take deep breaths and go in a comfortable state of mind. That's really like soften the intense energy, like during the day between the appointments. Whenever I just settle down and try to be comfortable and go like in a really soft state, like it really helped me. It really helped me. Yeah, thank you so much, Dr. Brice. It was really, as usual, wonderful learning from you. Thank you so much for your time. If you have a last word, what would it be? Advice or something for our colleagues?
Thank you, Jasmine. It was a pleasure to discuss together, as usual. And I said, explore the world of hypnosis. It's really a big change in your mindset, and you will learn a lot about your patient, but about yourself. So that's very important.
As well.
Good.
Yeah, thank you so much. It was really lovely. Please don't miss this episode of the Smart Dental Practice Show. Thank you so much, Dr. Brice. It was really an honor. Thank you, guys, and see you soon. Goodbye.
Goodbye.